health regulations, that I hope that you're aware of these discussions. There are digital components, so the idea is that maybe in the future we can look at this network as the tool to operationalize these high-level discussions that are taking place at the global level. Also, maternal and child health cards or home-based records, and of course the international patient summary. So this minimal, non-exhaustive set of clinical information such as immunization, allergies, pre-existing conditions, medications, etc. So helping when you are traveling abroad, the health worker about your conditions or any information that you would like to share when you are traveling. And as we said, each use case will require further consultation among technical experts and member states. So this is something that WHO won't decide, but that will be discussed with the member states. As of now, and this is growing and growing and growing, okay? This is 37 countries. We have received more interest from a lot of countries, but this is still not formalized. That is the reason we are only showing these countries that are formally part of the network, okay? As previously mentioned, we anticipate more countries to join the network, given the information circular sent by Dr. Tedros to the member states. And we know from the interactions with the member states that there is a clear recognition of the importance of this network as a core piece of global public health infrastructure. Finally, these are just some links. I assume that the presentation will be shared with all of you, so you will have access to that. And with this, I would like to conclude, but again, I would like to finish as I started saying that this is the time and this is the moment. We know that there's a lot of questions, but if there is a time that we can really move together in digitalization in the health sector, this is a network that will help us to do that in that way. Thank you so much.
I think just to drive home a point, and first of all, David, I don't think everyone in the audience knows what a phone book is.
Oh, shit.
So we age ourselves very clearly when we talk about phone books, because I don't think I've seen a phone book in 10 years. So
well, that is when we are getting old, and then
I'll just say welcome to the youth representatives,
yes, exactly.
who have not seen a phone book.
In the second row, we have some of them.
But you can imagine what a phone book would be if there was such a thing. But I will say that just this idea of a trust network, for those of you who aren't health informaticians or health architects, digital health architects, many of you used trust networks to get here today, right? So let me ask, does anyone have a passport in their pocket? Yeah, do you want to just pull it out? Okay, so this document, there's a little chip right here that in the last decade, almost every member state in the UN issues passports that has a chip, and that chip is a representation of a trust network maintained by ICAO as the trust anchor that verifies the authenticity of the credential that is carried by the individual, right? So when you checked into the hotel you're staying in Berlin, you most likely pulled out a Visa card and used the Visa card to pay for that transaction. Right? And the fact that there's a logo on that Visa card, and the Visa card is part of a broad network of financial entities that use that trust architecture in order to conduct financial transactions around the world. So trust networks are part and parcel of our daily lives. But as David said, we have no time to lose. The pandemic was a wake-up call. It was a clear indication that business as usual was not good enough. And so we need to really heed the lessons that came from the painful experience of these last several years and learn how to move forward. So let me now hand it over to Maya for the next part of this session. Thank you.
Thank you very much, and welcome, Romeric, to the panel.
Thank you.
Yeah, so thank you very much for both those presentations. I think one thing it really showed, especially Marco's presentation, was when we're faced with a crisis, incredible things can happen. The creativity and also the collaboration between the EU member states was incredible. And as Marco said, it was 24/7. There were meetings every single day, 2-3 times a week, but there was definitely this core group who believed that we could create this digital COVID certificate which would enable freedom of movement again, to get some parts of our lives back to some sort of normality. And we have Stephanie Weber here, who was part of that core group, I think, and working very hard as part of the, representative of Germany and also the chair of the semantic subgroup in the eHealth network. So maybe, Stephanie, you can reflect a little bit on kind of how big a leap this was, and what do you think are the advances that have resulted from this experience of developing the EU DCC?
Thank you very much, Maya, and thank you very much, Alain and Maya, for inviting me to this panel. So I hope I am hearable. So after this great presentation and after the introduction, it's really hard to point out more advances we had, but I'd like to join the presentation from Marco in saying that this has been quite an intense experience to developing this. I shared many of those late nights, early morning, full day conferences, and I think this is a benefit as well that we can take along for future endeavors with a new WHO network now. The possibility to talk together, to learn from each other, to have a group and a network of experience where all countries were willing to bring their best effort to this and to solve this. Of course, driven by the pandemic, everybody was in crisis mode, and a late night call in a crisis mode is possible. It might not be possible in a 10-year long run, but it was there, and we learned from this that getting together, talking about the problem and reaching a consensus on what to implement was very important. So there were, my role in this was kind of chairing the meetings on the data elements that were reported there. And we saw that the standards and the landscape of technical interfaces used was quite heterogeneous across Europe. And bringing this to a consensus that would be used in the short time frame of 4 months that Marco lined out was quite a challenge. And in some places we thought it would be hard to manage, but we did. And the way we did it, I think, with the openness and transparency and putting it online and people commenting on this, we reached a very good compromise. It's not always perfect in all places, but it was a workable compromise, and this was, I think, one of the great lessons learned, and this would be something to take along for the future of this new network, that it's important to really look at what countries are coming from what situations, what they need, and how to bring this together in a joint worldwide compromise then, which is, of course, even bigger than the 27 European different situations. So I think that that is one of the key benefits among the all others that personally, and of course the citizens of Germany had, of being able to use this network and being able to move around with the certificate and use this certificate for other use cases like entering a restaurant and entering public buildings and so on, which was not really the scope of what the certificate was developed in the first place. It was more of a cross-border movement. So I'll leave it here, and thanks again for inviting me.
Thank you. And maybe just one figure to get your heads around was that 2.3 billion certificates were issued. So this is in quite a relatively short time. Yeah, 2.3 billion, which shows you how much, how well used it was, but also how needed this was. And that's why we're particularly happy to be here to show that we are not losing all of this very important kind of information, and the institutional memory, we hope it will be safely within the hands of WHO. I now move on to Romaric. So welcome, glad you're able to find the room. We're very happy to have you with us. So Togo was the first sub-Saharan African country to join the EU Digital COVID Certificate, but you've also joined other trust networks. So we'd like to hear a little bit from you about what you see are the benefits of connecting to these trust networks, and in particular, obviously, the EU Digital COVID Certificate.
Thank you. Thank you for inviting me, and thank you for the opportunity. Sorry for the delay, but I came right away from the airport to this session. So, okay. So it was a great opportunity for us to join the EU DCC COVID network. First of all, it allows liberty of movement for our citizens. At that time, everything was restricted, and the citizens were happy now to move around again. Secondly, it was also a kind of validation of our COVID-19 digitalization process, because when we started this process, it wasn't clear in the mind of everybody that we are going to succeed in the rollout of the vaccine program, because we started with an enrollment platform, and then we move on slowly toward the vaccine certificate. We did issue our own certificate at first, but secondly, we decided to join the EU DCC so that our certificate can be interoperable around the world. Three, it's opened a new area of innovation, as now we are issuing verifiable credential for different use cases. It's not anymore for COVID-19. And it raised the awareness of the Ministry of Health about the impact of digital solution, because it wasn't quite, how can I say, obvious for them that digital can help them solve issue. In fact, they decide even to start the vaccination without any digitalization process, and we had to force things in order to do this enrollment platform. And then we had to interconnect. This is my last point. This is the fostering of collaboration, because we start the enrollment platform, but the Ministry of Health were using the DIHS2 software. So we have to interconnect with this platform. And then the citizens start the enrollment. They get a number, what we got, enrollment code. And then they go to a vaccination center, and in the vaccination center, on the DIHS2 software, the operator can retrieve their name and vaccine them electronically. And then from there, they can go to another platform where they can get the different certificates, like the European one and the African certificate. So overall, it was very, very positive for us, for the citizen, even for the practice now of the verifiable credential, because the European standard was clear, light, contrary of DIVOC, because at that time we were looking also into the Indian solution, they call it DIVOC. But DIVOC, you will see that the QR code was very heavy because it's very verbose, but with the European standard, it was very lean, very, light. So perfect for us. Thank you.
No, thanks a lot. And what you remind me is about, the importance of digitalization. And we keep on, every conference now that you go to, we're talking about the transformation of health systems, and digitalization is a core part of that. But it's very important to actually hear what that means in practice. And the EU adopted a global health strategy last year in November 2022. And I'm very happy that one of the key principles, Principle 4 of the strategy, is actually embedding digitalization, fostering digitalization as an enabler. And I think that's something that we all have to get our heads around much more, that it's not an add-on to the health systems, but as Romerick said, it should be right from the beginning. If you're going to launch something new, the digital aspect of it needs to be right there in the planning phase. So thank you very much for bringing that up. So Alain, I'm going to hand over to you to ask the second set of questions.
Yeah, absolutely. Thank you so much, Maya. And as you say, this idea of digital health being a separate thing is actually going quite out of fashion. I think as we reimagine health systems, it's critical that we think about digital in health, as the recent World Bank report was titled. It's how it's baked into how we deliver care, how we enable public health systems. Citizens around the world are expecting nothing less than to have the convenience that they are experiencing in all the other sectors of life be reflected in health as well. So let me turn to David, and David, the WHO has taken up the EU DCC and is now serving as the trust anchor for this global global network. And as Romain, you said, there were, during the pandemic, a large number of networks that were stood up regionally to try and create this advantage. And part of the groundwork that you mentioned over the first few years of this process was to actually test all these various networks and to assure that these networks could transition to being part of a global network where the lift and the complexity of coordination across the network would be made much easier. So could you speak a little bit to the potential future use cases of this digital certification network?
Sure. It's a bit awkward that you're leading that, but I will speak about that. But it's fine, you can compliment me. So as I said during the presentation, right, first of all, reflecting on Romari's comment, all these efforts have shown that technology is not the problem anymore, right? When we look at 10, 15 years ago, technology was the problem, the infrastructure. So now that is not the problem. And I think that also we need to reflect on that in what is missing that is really helping us to move in this direction. That they basically is about policy, it's about regulation, it's about the lack of human resources. That is something that is currently missing. So right now, finding people working in this area of work is almost mission impossible. Okay. So with that being said, we have a good digital ecosystem. We can move. We know what is missing. Some areas of work that we are already exploring as potential use cases, starting by as I mentioned before, the operationalization of the international health regulations reform. That is something that we are very interested to see how we can really fight any potential next pandemic and to be prepared for that from a digital point of view. That is something that is critical. Also about the international patient summary. That is something that also, there are of course really good efforts about that, but that's my dream as a person, to have the possibility to travel with my personal record, and if something happened to me, I can receive at least the health worker that will attend me if I have a problem, can have the basic information for me. That is something that I hope that I won't die before that happens, and we can really move. And Alain already has an example that can happen. Also about routine childhood immunization. So it's basic information that are needed, and that we need to do more and more to move in this direction. The credential of health workers. We have seen the potential of doing telemedicine cross borders, but there are some things that are needed in place. So maybe this network can help us to solve or to try to address these challenges about health workers and how we can really work with this cross border that most of the time is about, again, regulation. It's the same, and I am talking from 10 years ago, working for the American region, looking at countries. I will mention the country without mentioning the other country. I'm not going to mention any country, sorry, I'm going to take that back. To see that regulation was the problem to really provide health services with digital solutions. It was a legal issue. I'm talking about 10 years ago. Regrettably, we are still in the same position, right? Even though we are trying to move. So it's all, we need to work together to address this, because we are used to look at the European Commission, DG Santé, DG Connect, WHO, other international agencies, expecting that we are going to find the solutions. But the time is now, and the we is all of us together. So not only us seated here today, right? And about what could be faster developed, and looking at how COVID-19 certificates work, maybe the international certificates of vaccination or prophylaxis could be the next use case that we will move if everything goes okay. But I will really emphasize, as I said during my presentation, that this is something that should be prioritized with the member states, and we will support member states to move in this direction. And I don't know if you want to complement that.
No,
Thank you.
Very, very well said, David. So technology is not the problem. It's people, policy, and process that we need to solve. And so it's a very important set of advice to us. So thinking next to move to Stephanie, and from Germany's perspective, how does Germany see the benefits of the Global Digital Health Certification Network, and what are the use cases for Germany are the priorities?
So Germany has released a digital strategy for health as well, not so long ago. And of course, there are a few things that overlap with what the WHO is now planning to do. Being part of the EU, of course, we orient the digital strategy along the lines of EU strategy. So there is, as you might know, some regulation in preparation for a European health data space, and that, of course, is a big priority for Germany as well. So there are key tasks and key priority areas that we would address first. Among one of them is the patient summary that you just named, David. And this is, of course, a topic that is of interest. So, as I said before, I think for Germany, the learning from other countries and the learning from the establishment is something that helps us to bring our digital health strategy forward. And this would be a key benefit if we can work with WHO in developing this, to learn from worldwide experience, to discuss this together and to reach consensus on a possible way forward. We have a long-standing discussion. The International Patient Summary comes from an early EU project, the EPSOS projects, which many years ago, and evolved to a SAN standard, an ISO standard, and now is really acknowledged all over the world. And there are so many initiatives working on this, and it would be very good to bring these initiatives together and have a forum for discussion. So I think that is a very big benefit, that not only for Germany, but for Europe as well and for all countries. Learning from this, bringing your national needs to this network, and then agreeing on the best way forward. Acknowledging that not always it will be possible for a country to do exactly the same as WHO is pointing out, due to legacy, national legislation, and so on, but to have a way forward in moving towards an aligned strategy, to not having to translate and modify data when it reaches a border and has to be taken along, but to have a way to make this possible is, I think, one of the key benefits for Germany as well.
It's fantastic. I think, as you point out, empowering citizens, empowering people to be custodians of certified, valid data that is trusted across borders, within borders, that's a really great vision of the future. And I think, I was showing this earlier, and all of you are welcome to come and scan. This is just a demonstration of what this international patient summary looks like. Of course, the data is not real, but you can get a sense of how this would be empowering for migrants, for migrant laborers, for travelers, anyone crossing borders, people going on pilgrimages, using this kind of patient summary as a way to carry the essential health record needed in the event of an emergency. It's a game changer. And vaccine records. If there are any parents in the room, you know how frustrating it is to every time you go and seek care from a new clinician. Very often you have to sit there and dig through pieces of paper to figure out what is your child's immunization record. Having that be centrally managed and digitally available would be a game changer. So as you mentioned, WHO, we are at the service of, and we listen to and support member states. And member states are at the service of their people. And so, Romeric, let me turn to you and ask you about Togo's perspective. What are you hearing from citizens in terms of the next use case that they want Togo to prioritize? What are the services enabled by trust architectures that you think you as a country want to focus on?
For Togo, and from the perspective of citizen of Togo, yellow card should be the next step, the obvious next step. And secondly, the patient summary.
Can you give us a little
Okay.
more? Feel free to elaborate.
Yeah, I can elaborate because in our country, yellow card is also a vaccine record for children or for adult or for any citizen. So if we digitize the yellow card, we can solve also the problem of how the parent must keep the vaccine record of their children and how the state also can ensure that all the citizens are correctly vaccinated according to the policy of the country. So, and for the patient summary, it's also a good thing because you talk about cross-border, and I think it will help also push forward the project to put in place this vaccine record platform in our country, because until now is not a reality. So I think that the initiative can help drive it.
Yeah, fantastic. And I'm sure, like many of you in the room, I have at least 4 yellow cards that I've lost them, and I had to find another one and get it reissued. So it's certainly not the most efficient way of working in the 21st century. But it's great to hear this perspective of a member state, and I think the more member states make, as David pointed out, make the case, Germany, Togo, and others, that this is what you would like to see happen, then that can rapidly become a reality. So let me shift now to Marco. And Marco, as many have pointed out, you really were the part of the fire underneath this process to make this possible during the pandemic, during a time when there were so many other things flying around. You managed to see this vision through and make it a reality. You also were part of the fire that helped to transition this to WHO. And so you have a lot of experience as one of the architects of these systems. What do you think are the key ingredients necessary for trust networks to be successful at the global level?
Thank you. I would like to remind everybody what it means to talk about interoperability. Alain, you were very clear. It would be fantastic to take my QR code and go somewhere else, But the second step is that where somewhere else somebody is able to read the QR code, understand what is written there. It doesn't matter whether it's in one language or in another language. Everyone understands what is written there in their own languages. Mm-hmm. So when we stuck to the interoperability, you are totally right. The real issue there is not just the technology, it is the process and the people that are around it. So in my opinion, or my lessons out of this exercise is that there are 3 elements that are the key ingredients. So the first one is trust, the second one I would call it flexibility, and the third one is support and capacity building. So trust has several dimensions. The first dimension is that you create a system that that is trusted by everyone, all the stakeholders. When I say all stakeholders, I mean the citizens, because they know that their solution is treated with lawfully, so with full respect of the law that it's subject to governing that kind of information. But trust also means that when it comes to, say, the technological choice that you mean that there are no other effects out of it. So, for instance, you all know that the systems that we created was based on offline verification. It means that, it's checked everywhere, but you don't inform anybody else that you are being checked. That was one key element. So, trust is the first. The second one, and together with trust, you also have this openness and transparency. You mentioned Stephanie, so essentially we published everything online, so exactly as you are doing, so people can see what is there, and you don't need to invent or do speculation. It's there. You go check. If you like, you like. If you don't like, you tell us, and we take it up. That's what we did. Second point is a flexibility. You don't come by telling everyone else how the world should actually revolve. You fix the minimum elements to make it revolve, the spin, and then you leave flexibility to do the things as they have to be done. So take 27 member states. Italy is regional, France is not, Germany is a different region. You're not going there and explain to people how to issue a vaccination certificates. The only thing that you have to do is to create a minimal set of specs and give the flexibility to the member states to decide how they want to issue. And then and ensure that everybody else can verify with authoritative verification. And the third one, it is capacity building / support. don't believe for a split second that everybody will understand you when you publish the document, that the specifications will be understood. You need to provide support to those who develop the technological solutions. And one of the lessons that we learn is that the approach that we use, the so-called, we call it reference implementation. So what do we mean by that? Is that, the code, the QR code was also stored somewhere, in the app. So what we did at the Commission, we did not only create the specifications to issue the QR code, but we also created software, open source software, for countries that wanted to issue these certificates to take it immediately, so that we created a sort of level playing field, so that irrespective of where they were in terms of capacity building, they could issue these certificates within the 4 months. So these are my three main lessons, I would say, that I would like to share with you.
Yeah, I think those are fantastic, and really I think highlight this. If it was lost in the presentations earlier, I just think it's worth bringing to the forefront. The European Commission or the European Union consists of 27 countries, and there were more than 80 countries participating in the EU DCC. So that really speaks to the understandability and the clarity of the value proposition that this represented. Maya?
Yeah, thanks. Maybe just following up from what you said, I think it's often, because I've been working now in the EU for many years, and often you can see it a little bit like a kind of a natural laboratory. Because as you said, there's 27 countries with 27 different health systems, different approaches. And so working together, often many of the difficult issues will come to the fore, and we make compromises. And through that, as I said, you get innovation and creativity. And I think we saw that very much during the pandemic, where we were all forced to do things that, the technology was there, but maybe the political will had not been there. And so it crystallized under this one of the examples. There are other also, which I think we'll speak about a little bit later, other things that have come out of it. But I think the digital COVID certificate is one of the jewels, if you like, that came out of this very difficult period. Stephanie, maybe you want to also speak a little bit more about that, what was going on in the semantics group, and what advice would you give now to the WHO in developing further the Global Digital Health Certification Network?
Yeah, thank you for that question. That really brings it down to the core of where I was involved. When we started this, we found out that in many fields, in many of the data elements we wanted to capture, we did not have unified standards. So each country, because of historical different stages of digitalization or just paper documentation, relied on different settings. Some countries even did not have any standard at all. And then we found that in some places we had kind of two conflicting standards. So some countries a group of countries took the one, a group of countries took the other, then standards evolve. So this discussion of what to put in the regulatory or the network and how to link to the other standards is a key issue that really took us many calls, many night calls. For example, how to put the name of the vaccine in the vaccination certificate. What would be the source of this code you use for it? So where do we take it from? And nationally, there's tons of different approaches, but then there's a European Medicines Agency. Can we make use of what they develop and so on? So this process really took some time, and it helped countries to learn, and it started a process to now pick up on all the medication. How could we make this possible in the, for example, e-prescription, to make use of this, and so on. So from this initial intensive discussion and some other discussion who already lingered on there for many years, we now pushed it forward quite a bit. And I think this is the key lesson learned to take up as WHO. You're an organization with a worldwide community who can reach all kinds of different settings. So the benefit of this network, as I said before, would really make use of all this knowledge around the world and start this discussion and then agree on some joint recommendations, which for countries who do not have something yet might be very helpful, and for other countries it would be the anchor to link to, because not all countries might be able to switch. So if I have one code that I use and it's embedded in my whole health system, I cannot just say, I take the other one from WHO. So how do I bring this together? How do I link to this, enable these possibilities for countries to link to this network and have this in discussion forums such as we have the subgroup on semantics in eHealth here. I think that is a lesson learned we would like to give you along, and we would hope to see this, and I think Europe would be thrilled to be part of these discussions.
Great, thanks a lot. So Romrek, from your side, in Togo, as you explained that for you, it was very important to get in early on this issue, and now you said that you're looking at also digitalizing vaccination. So what's your ask to WHO? How can WHO help you? What are the needs that you have that you can join this network?
Okay. I can say that because we are moving toward now maybe a specific use case of patient summary, we should look into the technical specification of the QR code, because right now we are using HSET, and if we want to put more data inside, we should look at maybe another standard, in order to make it work. Because one problem is when somebody tries to scan the QR code and it doesn't work, maybe he just give up, and there is a point of how can I say trust in the use of the system, and there is a very key point. People need to know that it's working. It's not going to waste their time, specifically for those who need to check on those data. So my first point is about the specification of the QR code. So we need to make it faster, contain more data, and that's it for the technical point. And then I think my colleague here talks about the different open source software they provide for member states in order to fast track their process. I think that we should diversify the technology available on those open source software, because it was mainly based on Java and so on, and for some countries with limited resources, sometimes we need light implementation, like Node.js or that language, which are more lighter than that. But a part of that, I think the process of the onboarding process developed by the EU DCC for me was okay, and straightforward. And he talked about knowledge transfer and so on. So I think if we can keep that, it will help all the countries join faster.
Okay, thanks a lot. Lots to chew on there, David, about how WHO can support countries. But I heard very much about technology should be simple, should be easy to use, but also this issue about explaining to people what they're doing, how they're doing it, how it's trusted, safety. Nowadays we have a lot about data protection. So what is the WHO planning for anything to support this?
Sure. Thank you, Maya. So let me pause and briefly explain our structure, right? For those that don't know, WHO has a 3 levels structure, right? We have global level, right? In our case, represented by Alan, leading the vision and the guidance at the global level about digital health overall and innovation. Then we have regions. That will be my case, for example, for the European region, representing 53 countries, adopting this vision, this guidance, and try to tailor this global guidance to the regional needs. And then the country offices. Not all the countries have a WHO country office. For example, in the EU, we do not have a WHO country office. But for most of the rest of the countries, we have one that is trying to implement and execute all this guidance and technical guidance that we are providing to the member states, right? In terms of the content, what we are doing, it's so fascinating that I joined WHO almost 15 years ago, so I consider myself a dinosaur as part of the system. And you can see how everything has evolved and how in the past in WHO, it was impossible to see a non-public health profile in the system. And now to move in this area of work, in this particular area of work, we need policy officers, with lawyers, engineers, sociologists, anthropologists, we need absolutely everything. And that is fascinating, right? And that is driven by digital solutions. So I wonder why we didn't do this in the past, right? To move in other areas and not only for digitalization. So 3 kinds of support, coming back to your question, Maya. First, to support about the technology itself, how a country can really move in this direction. And for that, we have teams at the global level, mainly, and then more discreetly at the regional level, to advise countries in how to move with all this technology. That will be one piece, advising in how to move and adopt all these technologies in a safe, secure, and ethical way. Also about the legal part, that as I said several times already today, how we support countries in moving in the legal way to adopt these solutions. And I can promise you again that this, most of the time, the main challenge that we find, the legal part. Not only for these trust networks, but also to working on telehealth, electronic health records overall. So most of the time we are missing that this is not about technology, because technology is the tool, not the solution. So that is something that we are also supporting all the time. And finally, and this is actually the most important one, the guidance. So we are all the time supporting countries developing this technical guidance that should be adopted by the member states to really move in this area of work. And I would like to finish making 2 points very clear. For all of this, we need resources, and we need more. Of course, this is not a donor campaign now in public, but we need more resources because there is a growing interest. As I said before, during the pandemic, there is a increase of the health budget, and regretfully, we can see how that increase in the health budget is going down. So we need to keep the momentum, not only us, but also you working in this area of work, to keep the interest in the health sector and particularly in digitalization. But also, as how WHO works, we need resolutions. So in WHO, usually, every year we have the World Health Assembly, that is the most high-level body in terms of policy decision-making. So member states propose resolutions every year in different public health areas, and we look forward for countries standing up and going one step forward to really propose a resolution that is really encouraging us to move in this trust network area that we are developing. And for that, we really need that countries, because the resolutions are asked by the member states. So we're really calling you today also to encourage member states, without of course naming anyone, to really ask us to move in this direction through our legal mandates that are resolutions. Thank you.
Okay, thank you for that campaign speech. No, it's very important. You've hit, I'm surprised we haven't got to resources until now, but obviously it's very important that we need to invest in digitalization. And as you said as well, it's about new skills. And I know that in my department, I'm finding it harder and harder to attract people with the skills that we need now, especially kind of data analysts. I mean, public health systems now, it's all about data crunching and analyzing that. And so it's very good that you mentioned the skills that are needed. But Marco, moving over to you. So now the EU DCC, as you said, the regulation has expired. But that doesn't mean that the EU has stopped working on digital health. As Stephanie mentioned, we've got the proposal for a European health data space, which is quite an ambitious, bold, and first of its kind initiative. So maybe you would like to say a few words about that?
Yes, well, it's a continuation essentially of what we put at the center of our discussion. So it's the ability to access data, to share data in a trustful way. And, you know, for anything that is going to be developed for the future of medicine, this data, as you rightly point out, this will be the future will revolve around the oil data, and the energy, AI. So the two things will actually determine the future of the way in which we deploy services in the healthcare. So the European Health Data Space will be one of the building blocks because it will allow in the 27 member states a set of rules clear to everybody on how to share data and access data between healthcare operators or citizens that want to share data for primary use, that you know, so it's my health, so I decide to whom I share my data with which doctor to do what. And second, how to access and share data for research or for developing new drugs, for developing new treatments, so the secondary use of data. And this set of rules are essential because they will determine clarity between the operators, everyone. And you also, you know, you have the rules, but together with the rules, you also have an accompanying infrastructure. This is like the COVID certificates. We had the rules and we also had the infrastructure. And the infrastructure, in a way, it's already there because it is what we call My Health at the EU that allows, for instance, to transfer data between two institutions in two different countries so that people can access my patient summaries, and by the way, they can read my patient summary that is technically written in Italian, and they can read it in Luxembourg in a way that they understand what is written there without necessarily knowing Italian. So that is the essence of the future of interoperability with these technological solutions, underpinned by clear rules. Now, clear rules on data, but also clear rules, if I may, on how you're going to use that data in artificial intelligence. And I guess that the work that is being currently done on the AI Act, which is, it's worldwide known, this is the first steps to regulate the use of AI in Europe, will have a certain important effect into that. And I guess that, the European Health Data Space as the baseline will also enable us to move forward with other use cases, and moving beyond, say, the first examples of the EHR that we mentioned before, so the COVID, for instance, COVID certificates, and going to patient summary, yes, into e-prescriptions, but also in sharing images, for instance, but also sharing laboratory data and, for instance, the discharge letters from hospitals. So these are the elements that we do have in our agenda for developing within the 27 member states and potentially outside the 27 member state circles. And I think that at the basis of that, there will be the collaborations that we had so far. And I guess that even without the crisis, we will make it.
Okay, thanks. Any questions?
So it's impressive how this panel has stuck to literally the exact timing we had agreed to. And I have it on my paper, 12:12. Ask the floor for questions. And it is literally 12:12. So this is the time you've been waiting for. So there's a microphone in the back, and if you raise your hand, shake it around vigorously, the microphone will come to you. So.
Okay, I hope you can all hear me. My name is Caroline Knopp. I'm a regional youth champion of the Digital Transformation for Health Lab. And I'm quite excited about all the collaborations that are being built over the last years and the digital health trust networks that are evolving. But I guess there are a lot of challenges because there are no international recognized rules about digital health regulations and laws and also data security in place. So my question is, what are your plans on tackling this issue, and are there initiatives to try to build a common ground on those data regulations? Thank you.
So I'll just say one quick note and then ask which panelist wants to take that question. But just to remind everyone, these are the railway tracks on which these various train use cases operate. So data is not stored or transacted through the network. The network is the phone book of the public key infrastructure that allows for this cross-border sharing of credentialed health information. But that said, your question is also very, very valid and important. And who would like to? Would you want to address that? Because I think there's
yes,
Marco, why don't you take that?
Yes, I can certainly comment on, say, the European perspective there. And the question seems to imply that there is a little bit of a mess there, but it's not the case. It's not true. It's not totally true. Thank you. But the importance, in my opinion, the key thing is that those who are going to develop and deploy technological solution for a specific use case that we agree, they do operate in such a way that they listen to stakeholders that are not necessarily in that field. And that is challenging. So what do I mean by that? You would never go into an exercise of developing a system that accesses health data without mastering in full, in Europe, the General Data Protection Regulation. So if you do that, and you need to retro-engineer your systems to address, say, the remarks that you got from the Data Protection Authority, you extend sine qua non, or you extend too much the development time. And it is undermining, at the essence, the trust in your system. So the fact that the stakeholders that are going to develop these technologies, they talk up front, and you do have in your, say, milestones or the description of your systems, very clear endpoints where you check with those that are going to validate whether your system it is acceptable, it is key. Now, and the challenge there, and I go back to, I withdraw my things and relate to mess, it is that you have to create a shared vocabulary between people that do speak different languages. And, we probably, Stephanie, this is where we invested a lot. That's why it was 24/7, because we had to create a common grounds to understand each other. When you talk about platform, platform for a computer scientist means something, platform for those who develop codes mean completely different. And if you don't clarify these elements up front, you end up in having to solve a problem, 3 months in a row. So this is a challenge that, in my opinion, should be clarified up front, because the rules are there, At least, again, speaking from the 27, you do have rules on general data protection regulations. You will have the rules on how to treat data that is pseudo-anonymized, non-anonymized. You do have rules in the member states to access data. What it is important, it is not necessarily, and I close, to agree on the technical specifications that will not change forever so that everybody know. What it is important is that we do have an agreed mechanism to exchange the data. And that mechanism of exchange must be agreed by everyone.
Yeah. I'll add one sentence, and that is, people should always be the custodians and guardians of their own data.
Correct.
I think that's the principle that's universally agreed upon. It's fundamental to how WHO sees data. Data is fundamentally owned by the individuals who generate that data. Other questions?
Good afternoon, Muzammil Ismail from the Department of Health in South Africa. Thanks for a great presentation and discussion. So my question is, depending on the success of the country-specific vaccine rollout, did the implementation develop a backbone for EHR solutions in terms of demographic data, particularly in countries where no EHR solutions exist? And secondly, how can this be maintained in health systems that don't naturally have digital health capacity? Thanks.
I think there was 3 questions in that. Stephanie, do you want to take a first stab at that?
That's a tricky one. So I'm not sure if I can fully answer that. So I think in the European setting, most of the countries do have a backbone for that. So it was not the key issue to solve this in the first place. The problem was more to be able, if countries wanted to use the backbone of an existing EHR, how to bring the data to the infrastructure where we wanted to exchange it. So speaking from the past, it was not the key driving issue, even though some countries thought about it and discussed some. But this might be different if WHO picks it up, because there are much more countries probably who see the need. And I think there the balance, again, will have to come in. How do such a newly developed backbone possibly can align with the already existing backbones in many countries, so that there are not two different, or let's say multiple different systems, but where is it necessary to build something? How can that link? And again, I really would emphasize discussing this on a global platform is key to success on this. So for the second parts of the question, I hand over.
Yeah, and so to the point of countries that are only now generating their national architecture, WHO has issued a lot of guidance and has been working very closely with the regions to build that capacity at a national level. So first of all, people, governance, policies that have to exist prior to the systems being developed. But what we see is architecture that's based on robust open standards, so that there is the skeleton for interoperability across siloed verticals of the health system. One of those being EHRs and medical records. But the advent of open standards like FHIR have really unlocked a huge potential across socioeconomic gradients globally. We're seeing high-income countries adopt FHIR as a standard for exchanging information. We're seeing earlier this year, the African Union and Africa CDC issued guidance to all African member states to say FHIR should be a standard by which health information is exchanged. So I think the countries that are starting to build national costed digital health strategies have that greenfield opportunity to actually design and architect systems that are functional from the get-go. And they're not weighted down by legacy systems that don't talk to each other. So in some cases, they're actually at an advantage to where other countries from other regions may be struggling to join this new connected ecosystem.
Maybe if I can add, they should have an infrastructure thinking way. That means they need to build their strategy on infrastructure. For instance, three: the identification, the data exchange, and payment. So with those three, they will be able to handle, they are flexible enough to handle any use case.
It's the holy trinity of digital public infrastructure. We might have time for one more question before, please, yeah, you've been very patient in the front row.
Thank you. I'm Dr. Ghanati from Iran. And we know that during the COVID-19, we learned that digital health network help us a lot. And we can consider that for the future. What's the plan of the WHO for the future to expand it, especially in the developing country and poor countries? Thank you.
That's a perfect segue to our last segment, because I think the other underlying value that we're driving this forward with is that all countries should be able to participate, irrespective of their current technical or financial capacity, which is, I think, why David was emphasizing the importance of resourcing. A big part of the resourcing needed, the technical, the legal, and the policy infrastructure is what needs to be built at a country level to make sure that these systems can be set up and operated. The technical reference applications and the sort of open source technologies that are being made available are actually a fantastic building block as a starting point. So that hopefully gets us 80% of the way in most contexts. But it's certainly a founding principle on which this trust architecture is built, and we're looking at ways of really making sure that all 194 member states can participate in this trust network.
Is it time to wrap up?
I think given our German efficiency,
and Swiss.
we have Swiss-German efficiency. We have 7.9 minutes to to round things up. So I'll let you start, and then
Okay.
I'll say a few things.
Thank you. So first of all, thank you all for being here and having a good conversation about this. I think we wanted to bring this to you because we really felt that out of a crisis we found something very good that we would like to share. And so we're delighted. And as I said, for the EU, we stand very close with WHO. We support WHO. We want an effective and strong WHO. So we're delighted that we can work together and to see where this takes us. I think also maybe to the youth delegates here, I mean, I did public health 30 years ago and digital wasn't even a word in the curriculum. I would say as you embark on your careers, I think it's very important. We've seen that really digital should be part of everything you do. Question, if there's a new project or something, where is the digital element? Because I think now public health and health systems will be digital. And then the third part in that, of course, is the people. And I think one of the issues now is the skills. Where are the skills? What are the skills that are needed? What will the health professionals of the future look like? And in that, I also want to make a big plea that in this digitalization, especially the AI dimension, a lot of it is now being driven by tech companies or coders or people who have a very digital frame of mind. Make sure that the health professionals and the patients are also at the table. Because I think if we're going to look at things through an equity lens, it's very important that the people who are going to be providing the service, who are going to be receiving the service, are also part of the solution. Thank you.
Hard to follow that eloquent summary. But I think I'll take up on your first point, which is digital natives. If you were born at a time when Google was part of the world, like search engines, or the internet was part of your world, and you don't remember what the dial-up sound is, then you're a digital native. And I think, you should be questioning when we look at reimagining health systems. A lot of our health systems today and the way we do things are a reflection of the paper-based reality in which those systems were first developed or conceived. So the challenge now for us is to push those boundaries, to question, are we doing things this way because paper forced us to do them this way? And is this the way that digital first would have us do things most efficiently and in a way that engages the people that we're trying to serve? So that's really, I think, a critical question. And to the youth representatives in this meeting, the challenge is yours to carry that banner and push those non-digital natives who are sitting in panels and helping to formulate policy, that this is not the way things are optimally served. I think like we demonstrated, like ICAO does for passports, WHO now has taken on that mantle, thanks to the EC and the commitment to 194 member states to really serve as this trust anchor, to provide this phone book to member states and in an open source, transparent, public key infrastructure approach. And honestly, this is no less than a foundational building block of global health infrastructure. During the pandemic, we had to build the plane while flying it. And building a plane while flying it is not a definition for resilience. It's not a definition for pandemic preparedness. And so I think going forward, we see that there are multiple benefits to global health security, multiple benefits to citizens. Because at the end of the day, this is about people. It's about the convenience and the realization that we cannot achieve people-centered care unless we really build systems that provide convenience to the people who are using the health system. So you've been so patient, your questions were fantastic, and I'm really looking forward to engaging with all of you as we are all over the next 3 days. Thank you so much for being here this morning, and thank you to our distinguished panelists.